the presidential election. And of course, that's our stories in the headline for this week. And let's shift our attention to health matters now. The breakthrough on malaria vaccine has provided a glimmer of hope in the malaria response. But the right to quality time and affordable service to prevent, detect, and treat malaria is still not a reality for many people. This year's theme for World Malaria Day hopes to bring to light these realities and push the need to accelerate the fight against malaria for a more equitable world. There is more in this report.
This community in the Buari area of the Federal Capital Territory, like many others, has its own fair share of the residents being infected by malaria. Joma Unisa is here to get herself checked. She tells us about her experiences during all her pregnancies and the way she stays protected against the disease.
When you prepare for that time, before going to antenatal, you make sure you have something in your hand to collect drugs. And in that antenatal, they have to give you drugs, both malaria and other drugs. That is why I used to treat it at that time if I'm pregnant.
Pregnant women as well as children under the age of 5 are mostly affected, but disparities, which is both financial and otherwise, continue to put them more at risk. This outreach has been organized to give out malaria tests, preventive malaria medicines, and other medical checks that may be needed in order to reduce these risks.
The aim is test and treat for those that are positive and at the same time educate them on prevention.
The rural areas are the people that need this outreach the most, because these are the people that sometimes they will not even have the money to go to some of the hospitals.
According to data from the World Health Organization, Nigeria accounts for nearly 27% of the global malaria burden and 31% of malaria deaths. Children under the age of 5 are most vulnerable, accounting for more than 65% of all malaria deaths, and pregnant women are particularly at higher risk of contracting the disease due to their reduced immunity. This year's theme hopes to focus on the need to close the gap in the inequalities that exist in malaria prevention, detection, and treatment.
Children and pregnant women in particular should be given prophylaxis against malaria within the endemic months of malaria, which is about May to October every year.
Actually, at times in our local way, we used to enlighten our people that they need to keep their drainage clean, their environments, their houses.
Malaria is mostly found in tropical countries, but it is totally preventable and curable. Symptoms can be mild or life-threatening. Mild symptoms are fever, chills, and headache, while severe symptoms include fatigue, confusion, seizures, and difficulty in breathing.
Experts insist that identifying the signs and symptoms of malaria is necessary for timely diagnosis and treatment.
And joining me on the show now is Loveline Agbo Gabriel. She's the Monitoring and Evaluation Manager of the Civil Society Malaria Control, Immunization and Nutrition. Thank you for joining us on the show. Thank you. I'm really glad. This is a topic that every Nigerian must listen to. Malaria. When somebody's feeling temperature, feeling fever, you say, I'm having malaria and stuff. So, but it's World Malaria Day, and of course, the thing focusing, addressing the inequalities that exist in the prevention, detection, and of course, treatment service. So speak to us about this year's theme and what it means in generally for Nigerians, and of course, how we should be able to tackle the issue of malaria in Nigeria.
Okay, thank you very much for having me. Actually, the issue of malaria is an issue that is dear to everybody, because I believe in the room here, before, if we had to investigate, you find out that maybe 2 days ago, a week or so ago, somebody had treated malaria.
I did.
Oh, okay, good. So, and I did as well. So you see, it's something that is relatable to every Nigerian. And for this year's theme, talking about accelerating the fight against malaria for a more equitable world, is a theme that looks or takes into cognizance the inequalities that exist, social inequalities that exist within the societies where we live. And these inequalities are exacerbated by even the malaria itself, malaria disease itself. Now, this inequality, generally, if you want to talk about the word inequality, you talk about imbalances, you know, unequal distribution of resources and all. So if you think about how Nigeria is, the way we live, you find out that just like every society, different social stratas exist.
Yeah.
And because of that, the way things affect people, in this case, malaria, the prevalence and all in the different social stratas differ.
Exactly.
And that goes without saying that because of environmental issue, knowledge issues and all. And then the inequality there has to do with access to information, access to these services, and now malaria services, where it has to do with both prevention, detection, and treatment itself. Yeah. So this year's team is looking at the ways that these inequalities manifest when it comes to the work around intervention around malaria and how this can be dealt with so that we have an equitable, you know, and fair distribution of malaria intervention within the Nigerian society and the world at large, because it's World Malaria Day, not Nigerian Malaria Day, you know.
So I get it, you know. So there's been a lot about creating awareness for how people should clean up their environment, tidy up the environment. Mm-hmm. Like you have just mentioned, the diverse stratas of awareness need to also be created. But in communities, communities play a very important role in all of this. How does interventions into community, key into this, malaria response? How do we do it? Because you find that in some of these trenches, when you go into some of these trenches and where you see some of these children in the trenches, when they come out, a whole lot of them are treating malaria. Mm-hmm. First of all, I want to ask, how do the communities involved? How do we get the community? Second, people self-medicate when it comes to treating malaria. And I think that's the major issue that we should also be addressing.
Okay, so community-level interventions play a key role, particularly because nearly half of our population in Nigeria live in the rural communities. And access to information, again, I'll come back to it, because first, the way that things have been, the way that most interventions happen, you find that a lot of people are flocking to the cities. Now, you and I are in this room. This is a program. It's online. This is information going out. But how many regular Nigerians in the trenches, like you have used that word, would hear this? So that goes to say that we need to be more intentional, to prioritize the high-risk population who are mostly in the rural areas, and among them, women, pregnant women, and children under 5 are double risk of every other person even within the local communities. Now, backtrack a little and talk about a little of what we do as an organization, ACOMIN. So, in recognizing the role of community intervention, that is why we go down to the communities and get the community members to drive the intervention. Now, what do they do in driving the intervention? We try to collect data as to what's happening. Are the services available? Are you aware they are available? Can you access the services? If not, why? And then we run with it. And then what we discovered from the very beginning when we started this intervention, known as community-led monitoring, by the way, I have to mention, the name of this,
yeah,
community-led monitoring. So we discovered that there's need for a lot of behavioral change communication. Now, the behavioral change communication, looking at different areas, starting from environmental management, because that is where prevention is key.
Yeah.
Environmental management, which you have rightly mentioned, we can overemphasize the deplorable conditions that our communities are, with little or no access to basic amenities, environmental protection, you know, all of that. And those are the kinds of conditions that breed the malaria-carrying mosquito, the Anopheles.
Yes.
Mosquito. Now, after you talk about behavioral change communication for environmental protection, we now talk about health-seeking behavior, which you have rightly mentioned. People self-medicate. Everybody believes that as soon as I'm feeling feverish, it has to be malaria.
Exactly.
So this intervention goes down with their people, telling them, no, it is not every fever that is malaria. Because there is high risk to our organs for taking medications, especially when they are not going into your system to fight the particular disease you thought.
Exactly.
So we encourage people to change their behavior, go to the hospitals, get tested, and if you're positive, then you get treated. And then still health-seeking behavior, behavioral change communication about adherence to treatment regimens, because that's another thing. You start the treatment, you do not follow as it should be, you end it abruptly, the virus is not completely treated. And before you know it comes out, and that's why prevalence is high. So when the environment is not clean, you know that more mosquitoes will be breeded, and then they will bite. And then when they bite you in the house, you have malaria, and then the same mosquito bites another person. And so that's why you find that sometimes in a house, when one person has malaria, it's like it goes round. Now, so with all of that, that is why the prevalence is here, and that's why community intervention is key. Because when people understand, they do what they need to do at the grassroots level, then the prevalence will begin to go down. Now, before we even talk about the other bit of the commodity, because you're talking about people should go, improve health-seeking behavior, go to the hospitals, get tested. So when they get to the hospitals, and then there are no commodities to test, what then happens? And then they go to the hospital, they get tested, they need to take medication, and it's not there. So what happens? And then what is the quality of the service? Now, I'm even talking about in areas where there are health facilities. How about in areas where there are no health facilities? So this whole CLM work that we do, that's why we look at availability, accessibility, quality of service, and affordability. Then again, you know, I mentioned earlier that most of the interventions...
I just want us to round up. So in just 30 seconds, can you help me round up?
Okay. So I would say that we need to do more. A lot is being done, but it's mostly donor-driven. So as a country, internally, we need to do more. And I particularly commend the present government for taking the step to bring together relevant stakeholders to rethink how malaria interventions are happening. And I think with that, we are going to move forward, hopefully.
Thank you very much. I really appreciate it.
Thank you.
You've really done justice to it.
Oh, really?
Thank you.
Thank you.
Oh, yeah. So Nigeria's promises to begin work on mainstream Spanish language into schools as curricula. The Minister of Education disclosed these at the celebration of the International Spanish Language Day in Abuja.
Hola, gracias. Ay, Dios mío, ¿tú hablas español?
Spanish language is one of the most popular languages in the world, from Latin America to Europe and Africa. It is spoken by over 500 million people globally, and currently the second most spoken language by native speakers. This made the United Nations to recognize it as one of its 6 official languages. In recognition of this, the UN set aside the 23rd of April every year to observe this day and to celebrate multilingualism and cultural diversity. The embassies of Colombia, Cuba, Mexico, Venezuela, Argentina, Spain, and Equatorial Guinea came together in Abuja to also mark the day.
We are eager to promote the use of the Spanish worldwide. This is the most important for us, is to understand that Spanish, as any other language, is a means of communication.
We're here today because we know that there is that interest to make ourselves known, to make our language known, and to speak also to the authorities. And we are, in that sense, so honored to have the minister here with us.
It helps the country a lot to get it mainstream in part of the language menu, which students can learn at various levels of their education. So I'll be working with the various embassies to facilitate that.
We are ready for support of Nigerian kids, of Nigerian educational system, in all the projects for include the Spanish language in any part of the education level that the Nigerian deciding.
Representative of the Embassy of Colombia says part of the advantages of Spanish language is the opportunity for a fully funded postgraduate degree course in their country.
Very vast program that we launch every year, and the invitation is open to all the Nigerian professionals or all the Nigerian graduates who wish to further their studies in Colombia to come and taste our culture, to come and taste our food, to come and understand what brings us together, what makes us so diverse and so different and so equal at the same time, and further their studies. Of course, that's the main purpose, and then learn and perfect the Spanish language.
For some international schools already teaching Spanish language in Abuja, the occasion was an opportunity to test their knowledge of the language in games and interactions.
He told us Spanish stories, and he was very practical, and every day I learned something new in Spanish, and it was just very fun. That's why in grade 9 I chose to learn more of Spanish, and it's a very fun, and also it's a lot easier than French. Spanish is a lot easier than French. It has a lot of English words. Have French. Most of the time, our English words are totally switched together. But in Spanish, say telephone, telefono. It's pretty easy. So as a person that speaks naturally English, it's easy to speak Spanish. So it's easy for me to communicate.
With the array of opportunities the Spanish language brings, it will be a great advantage for Nigerians interested in learning a second language.
The Minister of Arts, Culture and Creative Economy, Annatu Musawa, is seeking support for children living with special needs in the creative sector by supporting and accepting them in the society. We have more in this report.
How they become who they are.
The federal government says it is committed to promoting a vibrant creative economy through arts and culture. The Minister of Art, Culture and Creative Economy, Annatu Musawa, spoke at the solo act exhibition featuring 42 works of this 14-year-old artist, Kanyechukwu Tagbo Okeke.
But he's been able to display his view of the world through his eyes, through creativity, using art. And this is very important for us as a ministry, because one of the initiatives that we want to embark on is art for health. To see Kanye doing it in a way that will inspire others, not just Nigerians, I think special needs people all over the world.
The theme of this year's exhibition is No Child Left Behind, and this year's event is held in celebration of World Autism Day.
The message for this year is just to bring hope and to give people the spirit to push on. A lot of families with children on the spectrum find themselves in very dire straits many times. But this, and what you see here today, is just a way of sending a message of hope to people.
This event seeks to raise awareness on autism and the challenges faced by the individuals on the autism spectrum.
We are now all the beneficiaries of Kanye's work and an inspirement through that. So today's art exhibit is just one demonstration of that, and I must commend Kanye.
Described as deep and highly intelligent artist, dignitaries at this exhibition share their thoughts on the range of artworks done by Kanyechukwu.
We have already realized the relevance of art
in health. And we can see the relevance of art in autism. We can see how this brilliant young boy, Kanye, has been able to communicate to the world through the innocence of his paintings and his canvases.
He has a very, very rich imagination. He is a young man that sees life through a different perspective and dynamic, and we're here to encourage, celebrate